Hi, I'm Dr. Fiona Lovegrove, and thank you very much for the invitation to speak about this topic, which is living well with psoriasis from my perspective, a dermatologist. So tonight, my role is really to give us a quick overview on psoriasis and how it really impacts patients' overall health. I will also briefly touch on treatment options for psoriasis and our current goals for treatment, as well as reflect on what the role of a dermatologist is in the care of a patient with psoriasis and how we can help our patients with psoriasis live well with the condition. So let's start with a few facts about psoriasis. Psoriasis affects people worldwide, up to about 120 million people. It does have different prevalences in different parts of the world, but overall, it's kind of reckoned to be about 1 to 8% of the population. 20% of those patients will have moderate to severe disease. And then we see what's called in medicine this bimodal onset, where we have some patients who get an earlier onset of psoriasis between 30 and 40 years of age, and others who have a more later onset between 40 to 70. This is a condition that tends to affect males and females very similarly. And in Canada, we have about 1 million Canadians affected by psoriasis. So that works out to be about 2.5% of the Ontarian population. And we also think that the prevalence of psoriasis is increasing. So during the study period that's quoted here, it seemed to increase from 1.7 to about 2.5% of the population in 2015. So psoriasis is a chronic immune-mediated inflammatory disease that affects the skin and other parts of the body, which we'll talk about in a moment. And what it looks like, which many of you may know because you live with psoriasis or have loved ones who live with psoriasis, but there are these classically well-defined red, or on darker skin types, more purpley, thick plaques with silvery scales. And this is just kind of a symptom map of what people who live with psoriasis experience. Many people report itching, plaque-related or skin-related pain. Many people are bothered by the appearance and unfortunately feel stigmatized by their condition. People also talk about scaling, bleeding, flaking, redness of the skin, joint pain, and stiffness and tightness. And plaque psoriasis certainly happens in people who have a predisposition towards it, but there's also environmental triggers for plaque psoriasis, which can include certain medications, infections. Strep throat is a very well-described one. Hormonal changes like pregnancy, obesity and weight gain can be related to the onset of psoriasis. Skin injury, including scratching of the skin or surgery to the skin. Stress is a known one. I mean, patients will often ask me, well, is this because of my stress? And I certainly tell them it's not helping. And then there's also known tobacco or alcohol use can trigger psoriasis as well. So how does psoriasis impact the whole person? Psoriasis, we tell people now, is more than just the skin. It's a systemic disease, and patients with skin psoriasis also commonly have arthritis, increased risk of cardiovascular issues, metabolic syndrome, and depression and anxiety. So with patients who have severe psoriasis, which is considered to be greater than 10% of the body affected, we know that these patients have a 57% increased risk of death from cardiovascular disease. So obviously this has a huge impact on the cardiovascular system. Metabolic syndrome. So the prevalence of metabolic syndrome happens with 40% of individuals who have psoriasis compared to 23% of individuals who do not have psoriasis. And this really presents as abdominal obesity, high cholesterol, high triglycerides, high blood sugar, and high blood pressure. Importantly, psoriasis also is known to be related to mental health concerns. So the risk of depression is known to be higher in patients with psoriasis and higher in men compared with women who have severe psoriasis. And we also are concerned because these risks of depression, suicidality, and anxiety are greater in our younger patients as well. So here's just a table looking at the overall risk of depression in patients with severe psoriasis versus the general population, as well as anxiety and suicidality. And you can see that all of those numbers are increased over the general population. So what do treatment options look like for our patients who live with psoriasis? So I talked to patients about this treatment ladder. So for milder condition, and even for patients with severe disease, we often start with topical therapy because it's safe and can be very effective. However, for more moderate to severe psoriasis, we look at using either ultraviolet light where that's available, as well as systemic therapies and what are known as biologic therapies. So biologic therapies are novel targeted treatments for psoriasis that are typically injected or injectable medications. And as we get newer tools to treat psoriasis, our treatment goals are also evolving. So back before 2004, when we only had conventional systemic treatments, so pills to treat psoriasis, such as methotrexate, we thought that getting somebody sort of half improved was a very good outcome. But now with the biologic treatments that started being brought to the market in 2004, and now with much more targeted treatments like IL-17 inhibitors and IL-23 inhibitors, we have much loftier goals, and our goals now are to achieve what's called a PASI 90 or 100, which is essentially clear or almost clear skin for our patients. And the reason why this matters is that having clear skin really does impact patients' quality of life. So this is a multi-center, large-scale trial in the US of 583 psoriasis patients who received systemic therapy or phototherapy. And you can see here that when patients were almost clear, about 44% of them expressed that their psoriasis had zero impact on their quality of life. So that's pretty good. But then when we are able to get the patient clear, where they have no psoriasis left, they rate the psoriasis as having no impact on their life in basically 3/4 of people. So you can see that going from almost clear to clear really does have a significant impact on people's well-being and perception of their disease. So when I was asked to do this webinar, I really was kind of sat down and thought about what I can do as a dermatologist to help my patients, not just from kind of outlining treatment goals and helping with treatments and treatment choices, but what is my role in the kind of well-being of a psoriasis patient beyond the medical. And so how can I help? I mean, I'm not a trained professional in mental health field at all, but really my role is to collaborate with other healthcare providers or practitioners, including the general practitioner or nurse practitioner, whoever the primary care practitioner is, as well as related or allied health professionals such as rheumatologists, who really, in my area at least, are very, very quick to see my patients with psoriasis to rule out psoriatic arthritis. Obviously, as I mentioned, I do my best to work with my patients to find optimal treatments for their psoriasis. And the other thing I tend to do is I advocate for my patients. So not only through doing things like this webinar, this seminar today, but also I will do things like, for example, a patient came to me recently and said that their gym wasn't allowing them to go to the pool because of their psoriasis. So I will write letters to ask, in this situation, ask the gym to let the patient attend the pool, because obviously the exercise is very good for their overall well-being. And psoriasis, as is often a misconception, psoriasis is not a communicable disease, and there would be no reason why somebody couldn't exercise or enter the pool with psoriasis. So thank you very much for your time this evening.
Thank you very much for having invited me. I'm someone who takes care of the health of people at the psychological level. I do research, and I also work with medicine regarding the question of the behavior and how it can change, so that I can help people who are working, for example. Good. Let's now look to the link between the body and the brain. There's a connection. Don't think that there is really division. The division is the real thing. This division is no good. The brain and the body actually form a unit. They are integrated one with the other one. And what we're doing is actually we look at the health for the brain and the one for the body. Actually, the reality is that the two things go together. We have to look now how the mental has an effect on the body, because the two things are integrated. That's why often I can see people who say, well, you know, is there something which is in my head? And just there. No, not at all. What we do have instead is that with experience we noticed that things go through the brain and we can see it. But that's because that's how things are. But right now, it's important to see the whole thing in order to better live. And what we notice, for example, among the athletes is that people who are running and run, and we have the body and you have the mental as well. And if the person now is in bad shape, that's because they are trying to control the pain. There is pain, but try to control it. We are trying, the brain is there to try to help us out with this pain. You have to understand how the brain actually works. Part of the brain is called the survival part, the survival mind, and it's there to take care of the appetite, of pain, and it also provides advice. For example, look around you. And it's also important to understand that it is something that works, and that's exactly why when we don't need to know what's going around us, that brain is there for us. It's working automatically. We can do things. We can also add things. So we can control certain things, but not everything. It is in the frontal lobes that you can now make a decision. For example, how you can do a thing, how you decide to do something. There you can make a decision for control things. That's also where you also think that you are holding everything in your hands, but that's not always the case when you look at the full brain. That's why there's things that take place around you, because we have used, for example, things the whole day. Now you're tired and so on and so forth. So now the brain is empty, if you want. The battery is gone. It's depleted. What does this mean now? the fact that you have a chronic disease and you are coping with it. Well, we have now data which are not necessarily the good ones. If, for example, try to do something, it may work, but there is things on which you don't have a control, so don't have a decision, but the brain is trying to survive. For example, we have an influence on a chronic disease, and you can add some data. This also means that there's other ways now to fix the thing or to manage it. Look at this in such a way that you can find a solution. And for example, there is a stress, there is a cause for it. And you can now look at what happens in daily life so that you can have a situation with factors that have stressors, but this is something that really causes something else. The chronic disease is something which is always there. That's what's chronic. And we now have to look how you can look at these emotions that with a problem that cannot be fixed. There is therefore things that you try to do. You look at these stressors. They're always there. It's something that we now have to develop so that we can take care of the chronic diseases. And that's exactly why people do not have developed it, or maybe they have, but very little. This also means that the body now is there. And there is some degree of uncertainty. Usually we do not have that. But when you have it, we have the control. And you have to think on how we can manage the thing. This is also true in life in general. When you look at what happened in the pandemic, you have noticed it. Things did not work the way they used to work before, and that's why there is a stress. It's there. And this kind of stresses will now use up the battery within the brain. We are tired as a result, because life goes on. We are getting one stress after the other one. And the fact that you cannot control for all this, you cannot control, for example, the wind. Well, it's not relevant because you can use the wind to your advantage. So, let's see now how we can now do the same with our brain. So, instead of controlling things, let's see how we can use what is there, the chronic disease, for example, and turn it to our advantage. There's an example, for example. There is a meeting, you're late. And it's real late. What do you do? For example, last week, there was a crazy traffic. And you didn't expect it. I didn't expect it. So what I want to do, I realize I'm going to be late. Well, my brain is going to tell me, well, didn't you look at the Google map, for example? Maybe try to go that way, go the other way. But you cannot think about everything. And maybe you're looking for something else as well. And you say, well, and the only thing which is sure, which is certain here is that you will be late, guaranteed. So what do? I put an app, and in such a way, when I arrived at the meeting and I was late, what I did is I worked when I was in the car. So instead of being there, go nuts and go crazy left and right, say, oh, I'm late, I just only think about that. No. You can work, you can turn it into your advantage, actually. You have to manage it because you're using the problem to your advantage. At times, you may wonder how it can work, but try to figure it out because your condition may change as well. It's variable as well. Exactly the same thing for drugs. It's the drugs can be used for different ways for different symptoms, so use them. And there is also things that you can be done. And what you're really trying to do actually may not work all the time. It's not because of you actually. It's because you do not have the control on how the disease is now reacting to what you're doing against it. So you have to invest in your health. You have to look at this chronic disease, look at what's important to you. And you have to look at our values as well. Values is what matters to you. For example, what you want to show to someone, as well as how you're going to contribute to the whole world, how we are linked to the whole world, and also what you care about. So you have to be able to show people what you want to show. So what you have is the model of the carrot and the stick, where you try to motivate yourself. Even if there's things which do work very well, that won't change a lot your behavior, because you're there, you know things are going to happen later on. No, that's not what you need to do. Your client will be there, you're late, and the things will not necessarily change. But look at, for example, the horse. With the horse, you can go there and start beating up the horse. It will work. That's the stick part. But you can also motivate the horse with carrots. The horse will go close to the carrot in order to get the carrot. That too is another way. So you can use one or use the other one. What you really want to do is to change the behavior of the horse. But what you're proposing here is not something which will last over the long term. What you do want is now change the behavior of the horse over the long term. And you are the horse. You want to change your own motivation over the long term. So you have to look at the sources of the motivation. For example, you go back home, it's in the evening, and people are going to scream because they're too late. That's a real question. Because if you do not go to the gym hall, you realize you're going to go back home, you are not tired, so you're going to be upset, and they're screaming with the children. So you have to figure out, try to make yourself tired so that you are not going to scream to the children. So go to the gym. Good. Once you have understood the mechanism, at that point you have to go on investing in this, and that's a value as well. Because maybe there's somebody who's good. You have to be nice. There's nice things, and it's something also you want to evaluate. Yeah, I'm going to do that. So, at times, you also have to at the fact that some people say, people are tired and they're losing hope. It's important to have hope. And this is also part of the chronic disease. It's there, it's still there. I do this, I have to do it again, I have to keep doing it. And there's not only other things, there is also the hope. You need the hope. It has to be possible, which means that everything is collapsing around me. But at the same time, if you now look at the things in a specific way, things can work. Just look at your targets, something that later on will provide a solution, a way whereby things will be working, whereby the world will improve. And that's true also for the chronic disease that you may have, or somebody else may have. Look at the pandemic, for example, and it's there. Look at the medicine, at the distance, which supplied help. And we did not have the right earlier to look at people over a distance. They need to be right there in front of you. With the pandemic, that has changed. So you have to believe that things that could not be done before now can be done. That's the hope. Because now you think it's possible. when you live now, you live a life which is meaningful, which has a purpose. This is not necessarily something that you can see right now. Maybe you need some time, or you need another situation. There could be another possibility. That yes, we're tired. Happens to everyone. I don't want to do it. I'm retired, really retired. And you also have to look at the fact that you need to reactivate yourself. And Viktor Frankl told me, he's a psychiatrist, he went through that. He went through the concentration camps during World War II, and he noticed that it's a question of life. You don't know what to expect from it, and you have to really look at what is expected, what life expects from us actually. So you have to find the solution. Of course, you can be worried about something, but it's very important that everyone has to look at what is ahead. You have to look at the values, and these values is more important than the goal itself. And actually, we found that out during the pandemic. We learned it, and we found out that we have to keep living with the pandemic. This is the thing that we noticed when they have this kind of chronic disease. Oh, I cannot do this, I cannot do that. No, it's not to work out. They have to now express the same thing in a different way. I can tell you that when we now look at the values, we can now see how we can change. If there's a behavior in your health in which you have to invest so that you can change, there are actually some sciences which are there to help you out. There are some tips so that you can see that the goal is getting closer to you. There are strategies actually for that, so that we can find a goal which is actually linked to the behavior. For example, motivation or something else. The fact that you do some exercise. All this is something that you can do. It's actually under the survival brain control. You cannot control it otherwise. It is also something that you can do. It's not really something which there is a real control. You are choosing actually, whereby you're choosing the behavior. And in this way, for example, you want to go there and lay on a sofa. Well, instead of laying there, stand up, go and do some exercise. And this will now be such that we can have a behavior which needs to be 90% actuable. And therefore, you will have also a goal that can be realized at the rate of 90%. Why? Because if it starts to work, you keep doing it. You're going to keep succeeding. And you will be now achieving the subsequent goal. When I talk to you about succeeding, well, you want to do even more. You want to succeed even more. Regard at with what is limited in your brain, that battery. Well, you have to see how you can use it and reuse it, maximize its use. And therefore, am I really using the battery the right way or not? Because you have to look at the circumstances around you. There are things that everybody can do. Look at the battery itself, on the frontal lobe of the brain. At that point, you have to make sure that when you try to do something, that the battery has enough energy in itself so that you can do the work. For example, please remember that you have to look at the goal so that you can use the battery to do it. And it works. After which, you have to make sure that it works. For example, look at the example. Don't, I'll tell you, don't think about the white elephant. The pink, actually. First time I tell you that, immediately the only thing I want to start doing is think about that pink elephant, because you're not supposed to think about it. It's always in front of your eyes, always in front of your brain. So do not do that kind of behavior, because it will have a boomerang effect. So I don't want to eat some sugary things. Well, what are you going to see? Candies all the time. So you have to do something else. You have to now look at things in a smart way. And you can then track your progress that you can do by having picked these goals which work at 90%. You won't have the brain that is going to be stuck in, I cannot do this, I cannot do that. No. You need to have something that can be done. And you can now observe. And at that point, you will be reaching to get to those goals. And finally, at times, sometimes there are setbacks. It happens. Life is like that. C'est la vie. And it's not that we try to knife you in the back. No, it's not that at all. What happens is that there's a problem. The fact is, when you do things, you fall, okay? But you also have to get up again. Don't stay down on the floor. Get back up. And what happens here is that you need to have something that will remind you that you can, by getting up, you can go back and do things again. Don't stay down there. Don't think, I'm there, I'm now stuck, and so I want to work out. No, you can. You're going to go back up, you're going to keep doing it, it's going to work. Be nice towards yourself, for example. This also means that there is sometimes criticism which is directed at the brain. And if now you try to look at the fuel that you have in your vehicle, you will notice that you have a brain which is burning because there is way too much fuel and there is mistakes, At some point somebody is going to screw up, as we say in common talk, and think at yourself that you have to be nice to yourself. That's going to recharge you. Finally, let's look at the fact that in order to recharge your battery in the brain, what you can do, you can make sure that you can do it. Think, for example, last time that you charged your phone. How did you do it? So, same thing. When you are charging the brain, at that point, you must have some energy to make sure you can work at the same time that you're charging. You have to eat properly. You must have properly hydrated. There's also differences which are individual. For example, somebody may be shy. So it's one thing is different than for somebody who's not shy. For other people, you have to go out, walk for 10 minutes. It's fantastic. For other people, it's something else. Other people have to go somewhere specific. So there is also other things which are healthy so that you can recharge yourself. And sometimes you just need to drink some water or something else. This may help you throughout the whole day. Look, therefore you have to consider what will be helping you. You have to integrate this in your life. You have to integrate all this in your life. Here, for example, are some other resources that I realized were very good for me. These 3 books, Living with the Enemy by Ray Owen, Get Out of Your Mind, and Healthy Habits Suck. There are some tips there. But we have even more. We have some therapy, group therapy, for example, or for individuals as well. And you can also access that as well. We know what it means to work with somebody who goes through these chronic diseases. We know that very well. For example, when we look at this problem of mental health, and that's exactly why we offer these group therapies and so on and so forth. So the reason why there is a group therapy is because this helps in cutting the costs. So if somebody cannot afford the one-to-one therapy, use a group therapy. It may be a fantastic solution for you. Here are my coordinates, my email address, and the internet. Thank you very much.
Hello, everybody. It's great to be here. It's great to be speaking with all of you today. My name is Sicily Mburu from IFPA, based in Stockholm, Sweden. Warm thanks to the Canadian Psoriasis Network for extending the invitation to IFPA. I do appreciate that we are able to converse and have a discussion around mental health and well-being. As you might be aware, this year's World Psoriasis Day focuses on mental health, and IFPA has carried out a couple of activities focused on well-being, including having published a report titled Inside Psoriatic Disease that sort of highlights the negative impacts of the disease and how it impacts one's life beyond the skin. So without taking much time, perhaps I'll jump into the presentation and give a brief background about IFPA. So we were founded in 1971, and we represent over 60 million people living with psoriatic disease across the globe. Currently, IFPA has 63 members across all nations. And the main vision is to sort of unite all people living with psoriatic disease and engage in a conversation on how it impacts one's lives, as well as their families. So part of the report intends to empower policymakers on practical solutions to improve the healthcare and include all people living with psoriatic disease. And the title, Breaking the Vicious Cycle, was chosen because part of the mental health cycle not only relates to one's individual person, but also affects the community around their lives as well as their families' lives. And what we're noticing and comes out as part of the report is that the science behind mental health and quality of life is now closely related, and much of the discussions on policies on mental health there needs to be more engagement on policies on mental health. And this, as much as this varies from country to country, the question we're asking from the report is, what is the world doing during this World Psoriasis Day when it comes to mental health? And the third item that we hope to engage on in the next 10 minutes is, how do we fight for well-being? What are the 3 antidotes that we're using as IFPA to engage and message when it comes to emotional well-being? And I think this includes advocating for diagnosis and proper treatment for all. We also aiming to show the human person, and that the person is beyond a collection of symptoms, and reach out to the policymakers to advocate for investment in mental health. So as part of this psoriatic disease report, the summary behind the science, that is the brain and the skin axis, is now clearly evident in many studies that are coming up. And amongst all dermatological conditions, psoriatic disease has the highest, prevalence when it comes to depression. So this clearly links that there might be more going on rather than when it comes to inflammation, and that the brain plays an important role when we're talking about the skin and the brain axis, and science is now, and research is now showing that this is actually true. And the second part of the report aims on highlighting, or rather sharing, a few items on how we can act on mental health collectively, individually, or as a country, and hoping to showcase and share that psoriatic disease is an obstacle to one's full participation in the society, be it in their work life, in their family life, or in their individual capacity. We also aim to bring in the these relationships that are negatively impacted have been highlighted in a couple of studies where I think in one study, 81% of the respondents share that the impact it does have on them goes beyond self, and it does affect their relationships with a member of the family or with their work partners, with their colleagues, as well as generally with their intimacy when it comes to their partners. Part of the aims, or rather what we also aim to highlight, is there have been policies and national plans when it comes to mental health, but these are slowly or sometimes not being adopted, and it varies from country to country. So hoping to share some of the findings of this report and seeing what can be done next, and encouraging all members as well as all participants, the general public, to use this report as a tool for their advocacy work, and particularly for their policy work, has been one of the core aims of the report. As part of this, and as we explore the quality of life, IFPA aims also, and I think together with the members, to show the humanistic burden, and that's what I would like to share in the next couple of slides, that there is a person behind the numbers, and that with proper health and mental health support, perhaps each individual can reach their full potential in life. We have some of our members who particularly have shared their insights and stories. We have Kathleen here from the US who shared that she wanted to start a family, but the doctor said, forget it. And I think this translates across many of our members, as well as many of the people living with psoriatic disease, that it can be an obstacle to the daily activities and in your daily life, and your life, how you relate to your partners. She also mentioned that she's lived with anxiety all her life, and right now she's realizing that psoriasis or psoriatic disease affects more than skin. It's actually what I mentioned, the brain and skin axis, which science is now bringing up more and more in the latest research. Kathleen is also joined by one of our IFPA ambassadors, Zakia from South Africa. Zakia shares that there are many aspects to this disease, and that it's more than what you see on appearance. Many people find that they cannot even go to work because the psoriatic disease affects their performance, and we are constantly afraid of what we look like. So going beyond self, there's also an aspect of the work productivity and the economic constraints one might experience when living with the disease, particularly when it comes to their work life. And then we also have Joel, who has been participating in the IFPA activities, including the IFPA Island. Joel mentioned that he got into the habit where, and he mentioned that he gets into the habit where and when he would flare, he would lose lots of friends. So based on this, the relationships that are affected go, again, just highlighting beyond family. It also is our everyday relationship with people who are around us. He also mentioned that he's a father, and he had his life planned out. So he talks about he wanted to go to be a sporty dad, an active dad, but all of a sudden, because of his psoriatic arthritis, this has brought a lot of issues, as he puts it, and he did not know who he was anymore. So Joel's story is everybody's story when it comes to psoriatic arthritis and joint pain. How best can we ensure that everybody engages in activities within their family, within the sports life, and I think some of these aspects are brought out in the particular report that we published. So when we look at the numbers, and I think this varies from country to country, we also note that 43% of respondents in a study we took with psoriatic disease had seen their life become worse, or the disease activity become worse during the pandemic. And nearly half of this people living with psoriatic disease also mention an increased tendency of anxiety. And I think this has varied from country to country, but we're seeing in total that the percentage of people diagnosed is now much higher than was before. I think the highest numbers are shown in the United States, with over 16% of people living with psoriatic disease having either depression or anxiety, and in this case, depression. And in countries like Malaysia, where 8.5% of people living with psoriatic disease have depression. Part of the report also shows that the 81% of people living with the disease, psoriatic disease, have negatively been impacted, like Joel mentioned, with their relationships. And if you were to count, out of 4 to 5 people have experienced some sort of stigma or discrimination. And I think for this World Psoriasis Day, we are hoping to sort of break these obstacles, or break that cycle where one's career choice, one's productivity of life, or one's productivity at work is affected by disease. And this should not be so. And I think that it's up to the community itself to address some of these issues, and as per the title of the report, break the vicious cycle. So as noted, there are a few key takeaways we can share from the report when it comes to discussions at policy level. What we're doing is we are hoping to urge governments to ensure that there's early diagnosis and proper treatment. So having the disease well managed early can reduce the burden in whole. So we are seeing if one is early diagnosed with psoriatic disease, some of the treatments that are given can actually suppress the inflammatory process and therefore reduce or improve symptoms that are mental health related, like depression and anxiety. Secondly, we also have the second core that I mentioned, which is sharing your stories, like we're doing right now, creating awareness and showcasing that there is a human person behind the disease. I think it's important not only at the clinical, or rather at the hospitals, to talk about the mental health and quality of life with patients, but also referring one who is having the disease to some sort of a mental health support service where needed. We hope that while directing a patient to a mental health support service, members and national associations then come together to support the person living with psoriatic disease with some sort of support group advocacy. And it's been shown that this does make a large impact when it comes to psoriatic disease. I think we have one IFPA ambassador from Canada, Rina, who says that dermatologists should ask their patients what they're doing, or rather what is happening in their lives, as opposed to just treating the patient and treating the symptoms. And then finally, and I think this is a call that has been shared also at global level by the World Health Organization, that good mental health is fundamental, and I think its overall importance cannot be cannot be stated more than we are at this forum during this World Psoriasis Day, and actually challenging our governments to look into the WHO Action Plan on Mental Health that was published. What is your government doing? Is it including mental health services in the health programs, particularly when it comes to non-communicable diseases? Is your government training the appropriate health workforce and the proper number of trained health workforce to support patients across the globe? So that is highlighted in the report, and it's directed to empower the policymakers to take into account the WHO report that was published. So I invite you to read the full report, to read some of the messages that we are hoping to create attention to this year, and of course in the coming years, and welcoming you to this World Psoriasis Day, October 2029, wherever you may be, to share a message on mental health build that support that we require from all our members to make the message even stronger and heard by all. So that is the end of my presentation. Thank you for your attention, and again, thank you for having me here. In case of any questions, please, you're welcome to reach out to IFA and I think the Canadian Psoriasis Network and associations that we work with to get the support that you require. And I wish you a successful World Psoriasis Day 2022. Thank you.